Good evening and welcome. Let's take a look at our top story this hour. As the United States witnesses a surge in the number of cases, with more than 900 cases reported in the last 24 hours. The White House has now called for stricter measures. Donald Trump's latest press briefing has showed a more somber United States president, a reflection on the gravity of the current situation in the country.
The administration is recommending that all Americans, including the young and healthy, work to engage in schooling from home when possible, avoid gathering in groups of more than 10 people, avoid discretionary travel, and avoid eating and drinking at bars, restaurants, and public food courts.
Trump also said that the government has a month-long battle ahead of themselves, and the U.S. president also believed that if they deal with the virus they would deal with the virus on a war footing. It may end by July.
Seems to me that if we do a really good job, we'll not only hold the death down to a level that is much lower than the other way, had we not done a good job, but people are talking about July, August.
But amid the outbreak, Trump said that postponing the U.S. elections is unnecessary. This comes even after Ohio's state's presidential primary vote stands postponed.
Postponing an election, I think, to me, that really goes to the heart of what we're all about. I think postponing an election is a very tough thing. I know they're doing, because they've been in touch with us, they're doing it very carefully. They're spreading people out at great distances, as you can see, and I think they'll do it very safely. I hope they do it very safely. But I think postponing elections is it's not a very good thing. They have lots of room in a lot of the electoral places, and I think that they will do it very well. But I think postponing is unnecessary.
The White House has also introduced coronavirus mitigation measures. Measures have been put in place for reporters at the White House. They include temperature checks before entry, as well as social distancing efforts, such as limited seating in the press briefing room. Meanwhile, coronavirus cases in New York City have reached 463. New York has the largest cluster of coronavirus cases in the United States, recording 7 deaths so far. Yesterday, New York announced the closing of all restaurants, cafes, and non-essential businesses. New York's Times Square, which is usually full of tourists, also looked empty as New York strengthened its restrictions. Washington, D.C.'s famous destinations also carried an empty look. Very few people could be seen at major landmarks, including the White House and Washington Monument. Well-known streets in Los Angeles area were also devoid of people. The busy promenade, as well as numerous restaurants and bars, were also empty after Los Angeles ordered the closing of businesses. Despite the U.S. government warning to avoid gatherings of more than 10 people, beachgoers packed the Florida seaside, while some cities in the state, like Miami Beach, have closed public beaches to try and slow the spread of the virus. Others kept them open. Now, we are being joined by Dr. Amy Edwards, a physician coming to us from Cleveland, Ohio. Good evening to you, and thank you for being with us on the show. Should everyone wear a mask in public? And if not, then who should ideally be wearing masks?
So the best people that need to be wearing masks are people that are sick. Masks are not great at preventing the virus from coming in, but they're really, really good at keeping secretions in. So think about the runny nose, the coughing, the sneezing. So people who are ill definitely need to be wearing masks. But if you're not sick, the best thing you can do is wash your hands and don't touch your face.
If not with the mask, then how should people be protecting themselves from the coronavirus infection?
They need to be doing the same thing we're doing here in the United States, and that's staying away from people. About 3 to 6 feet distance. That way, if somebody coughs or sneezes, it doesn't get on you. Washing your hands, that's super important. for keeping the virus that you might accidentally touch, like on a doorknob, off of your face, and not touching your face. That's key. You get the virus on your hands, and then you touch your face, and you get yourself sick. So wash your hands and don't touch your face.
Doctor, what is the difference between an N95 mask and a surgical mask? And what is the right way to wear these masks?
So a surgical mask is the kind of the cloth mask that you see that either ties behind your head or loops behind your ears. These have larger pore sizes. Again, that's why they're not very effective for keeping the virus from coming in. We use those again to keep secretions in, things like sneezing, coughing, and runny nose. The N95, those are the kind of the round masks that fit over your nose and mouth. Those do have a pore size that's small enough to keep the virus out. However, those have to be fitted. You actually have to have what's called a fit test, where you sit with a fit machine and get fitted to the proper N95 mask for the size and shape of your face. So if you don't have access to a fit machine, it's actually not a good idea to wear an N95 mask. It won't work if it's not fitted properly.
Right. Thank you very much for joining us. Unfortunately, our connection is not great. We're going to thank Dr. Amy Edwards, coming to us live from Ohio.